Hello, I think I'm live. Sarah Jane here from TYPP and Posh Podiatry Glasgow. How is everyone? I'm jumping on just now. Let's just make sure we are live. I think I am. It says I am. Hopefully we are. I am now live. It's telling me I'm live. I must be live. So, clinic has been closed for the last 3 weeks anyway to a month because I've been having some surgery. I had a hip replacement. So 3 weeks ago today, I had my hip replaced, but I'm doing well. And I wanted to jump on to just let you know, clinic will be opening properly soon. I'm actually in tomorrow, Wednesday, seeing just a couple of patients, just doing a little bit of a phased return, and I will be doing that over the next few weeks. So you'll see me in clinic, and you'll notice that my diary is open, so you can get booking in. I'm just going to reduce my kind of having a phased return back to work. I'm not entirely sure how it'll be. The consultant has told me clearly not to do too much. I need to listen to the advice that I'd be giving my clients and listen myself. So I'm just going to see how I do with that. I'll probably just be reducing my hours down. I'll maybe do some more days, less hours. So we'll see how that goes. But also we have Scott coming in to join us, who's a sports therapist just like myself and also a podiatrist just like myself, which is fabulous. So that offers us much more availability, and Scott is fabulous. Very much a keen interest in kind of sports, MSK, but basically like myself. But there's a few things in clinic that I wanted to update you on because we've brought in some new treatments, some new modalities. There might be some noise here because that's the kids coming back from school, so apologies if there is. The joys of lives. But so I wanted to just go through some of the different kind of conditions and treatments that we teach in clinic, because this has been something that it's been asked a little bit. So you can see my husband. Hi. He's bringing the kids back. So things that we do. So the website, I'll pop the website up for you on here so that it's easy enough for you guys to see. If you're watching this in replay, it'll be there as well. But essentially, I just put that up. That's the website there for treatment. So it's just poshmeperfect.co.uk. Now, essentially in clinic, we have a full MSK clinic, but we also do a full podiatry practice. We are podiatrists. Our speciality is MSK, musculoskeletal conditions, right? So arthritis, rheumatology, inflammation, sports injuries, foot, knee, ankle, hip, lower back pain are our absolute speciality. That is where we specialize. So lower back all the way down. So things like hip pain, knee pain, ankle pain, any kind of foot pain. We're specialists in that. Now, myself and Scott that work within the clinic are both sports therapists as well. So we are fully trained as sports remedial therapists on the full body. So within our clinic, we don't just look at feet and knees and hips. We assess the full body, hence the whole posture element towards the business. But so even if you've got shoulder problems going on, we can help you within that. However, if you were needing something a bit more like a steroid injection in your shoulder, we are not your people for that. However, if you have problems from the pelvis down, this is where I wanted to talk about some of the different treatment modalities that we offer, but from the pelvis down. So things like nail surgery. So if you have an ingrown toenail, we can absolutely do nail surgery. We can offer steroid injections up to probably trochanteric bursa. So if you were having kind of lateral hip pain, knee arthritis pain, ankle pain, foot pain, Morton's neuroma, arthritic type pain, any pain where there's basically inflammation has an involvement, then a steroid injection, we can absolutely do that there. Now, with any injections, we wouldn't just be injecting first line. There'd be a whole you'd be assessed thoroughly before that. But just to let you know, we can do that. One of the new exciting things that we've brought in is the Ostenel injections. So Ostenel injections essentially very different to steroid injections. So steroid injections, think about inflammation. So if there's inflammation, they're great for that. Now, I say great for that Steroid injections don't come without the risks. I don't want to go into all the details of that in this video, but that's something we go through in your consultation. But they are a steroid. They are going to have some side effects to them. Whereas Osterel, very, very, very low issues with that. Really the main one, like anything, if you're injecting, if you're breaking the skin, risk of infection. But Osterel, fantastic for arthritic joints, so knee arthritis in the big toe. So if you're getting pain in your feet that's related to arthritic type pain, the Osterel injections are fab. Hello, come and say hello to everybody. Come on over and say hello. So those are the Osterel injections. So Mummy's live, so you can come and say hi. Okay.
Hi.
Say hiya.
Yeah.
Hiya. And there's Amy. Right. We'll let them go back upstairs. Good day. Yeah.
There's 0 viewers.
Yes. Okay. Up the stairs. Bye-bye. Say bye-bye. Bye, everybody.
Science. So our science teacher let us film what we did today.
Perfect.
So you get to see it. Yeah.
Can't wait. Anybody? Real life. This is real life. Right. So right up the stairs, crazies. So where was I? Oh. So yes, that's Osterel injections. So they're fantastic. Think arthritic type pain. So they're essentially giving you a kind of buffer, like lubrication between the joints, where you've got that. Trust me, I know about arthritis. You've got that bone-on-bone rubbing, creating that inflammation, that whole cascade of pain that comes with that. So debilitating. So that's where the Osterel injections. Now for that, really the knee down for us as podiatrists, that would be within our scope of practice there. You can get Osterel injections also for tendons. So if you've got anything going on with your Achilles tendon, really, that's one to talk to us about. Steroid injections around your Achilles, no. I certainly wouldn't touch you with a steroid injection around your Achilles. It is likely to contribute to the rupture of that. It's not that you can't have a steroid injection around your Achilles tendon. You can kind of bathe the Achilles, the tendon in the steroid. But that would be done under ultrasound guided. So that, yeah, that's my feelings on that. So it would be an absolute last resort getting something like that done. So that's your Osterel injections, steroid injections, and PRP coming within the next month as well. So injecting your plasma into your joints. So PRP, what is that? So essentially better. It depends, right? So steroid injection, if you're really struggling with inflammation, it is for most part going to give you a bit of relief, but it's not the be all and end all, but it will get you out of that pain cascade for most of you. Osterel injections, great for providing that kind of lubrication of your joints. And then your PRP, so this is where we take your blood. Okay, so we would basically take your blood, just a tiny amount, it's not like lots. It's a very simple procedure. We then put it and we spin the blood and we basically separate it and we inject the plasma from that blood back into your joint. So the great thing with that is that it's not an external medication that's going back into your body. So it's your tissues, your blood, and we're putting that plasma straight to where it needs to, into that kind of joint space. So great for arthritic knees, great for first metatarsal, around the ankle joint, kind of pain around there as well. So that come mid to end of September, we will have PRP available as well. So that's within clinic. So with all of these things that I'm talking about, you'd be assessed clinically to see if they're appropriate for you. But it's just to let you know the types of things that we can do. Other things that we have is shockwave therapy and laser therapy. Now, these are quite different as well. So let's talk about that. Shockwave, some of you might have heard of that. It's a wee bit more out there. I think more so than the laser. Shockwave, basically pro-inflammatory. It's fantastic for tendons. So if you've got a tendinopathy, and especially good for chronic tendon problems. So anywhere in the body, as sports therapists, we can actually, within our clinic, we can treat you anywhere for that. Primarily what we see in that, things like really chronic plantar fasciopathy, tendinopathies, especially the Achilles, usually that kind of mid-portion Achilles tendinopathies. We can do around the glutes as well. And essentially, I know that with Linda, we used it. She has some tennis elbow issues there. So that's Shockwave. Shockwave, what I will say though is it can be a little bit uncomfortable. It's not horrendous. And actually research shows that we now go in at a lesser intensity, whereas maybe a couple of years ago, if you've ever had Shockwave, they would have hit you really hard, because that's where research was then. Hit you really hard, grit your teeth for that couple of minutes that it's on, and then that's it done. But actually, the latest research has shown that we tear you up, so it's not quite as bad as it was if you've ever had it before. And then medical grade laser, low level laser therapy, that is fantastic for inflammation. Now, during my surgery, or not during my surgery, because clearly I wasn't awake during my surgery, but post-surgery for me. So I had a full hip replacement 3 weeks ago. Now, it was a bit of a state afterwards. Maybe one day I'll share some of the pictures with you. I took some pictures, and I took the laser home with me. So I think we were 5 days post-op. I used it, and I was really bruised and battered. I mean, it's quite a brutal surgery. It's not a nice surgery. And I was black and blue. I mean, honestly, it was just a riot. And one of the great things with the laser, you can use it to reduce edema, so to reduce swelling. And with swelling comes pain. So when you've got that kind of swollen joint, you've got less space in that area, and one of the mediators of pain, so contributes towards pain. I had really bad bruising, and also you've got a wound there. And one of the great things with the laser is that you can put it on what's called the biostimulation. So we use it for nail surgery, we use it for any wounds. So I used it on my wound, and my God, the results, the differences even within a few days of that. Biggest thing was the edema, the swelling massively went down within within 48 hours. It's just insane. And the healing has been great. Now, obviously that was just me. There was no other trial or anything with it, but it's been great for me. But essentially the laser, where you've got an acute injury, where it's really sore and tender, and it's something that's maybe old, we can't treat you. Say, for example, you sprained your ankle and it was like right there and then, we wouldn't be able to use it. So after my surgery, I waited 5 days before I used the laser. You'd need to give it at least kind of 72 hours after an actual injury before we would use the laser on you. So when I say acute, I just mean it's not chronic. It's not been going on for months. So it's great for reducing the inflammation. All right, so kind of similar to what the steroid injections doing, but less invasive. But your steroid injection, you would probably only need that once every 6 months. You'd maybe get that, depending on what your condition is. Whereas your laser, you would have a course of 6 treatments, but there's no pain with it. Okay, it's absolutely painless. Laser is a pretty relaxing treatment. So that's laser. I'll get into more details. I have done some videos on each of these modalities, but I'll go in with them and we'll go through them. Other things that we can do is customized foot orthotics. So we mold our foot orthotics. We use the Sidash range. We also get Firefly. So these are just different manufacturers that we use. And we can do from off the shelf to fully customizable, depending what you need. Exercise rehab obviously is a big part of what we do in clinic as well. We mobilization and manual therapy, so opening, creating joint space. We do kinesiology taping. We also do cupping therapy, and we also utilize a technique, an osteopathic technique called muscle energy technique. So quite a varied mix of treatments that we have available. Main conditions that we treat, or that we're specialized in: heel pain, back pain, knee pain, shin splints, bunions, any kind of foot pain, Achilles tendinopathies, ingrown toenails, verrucas. Oh my goodness, verrucas, we can absolutely help you with them. Corns and callus, Morton's neuroma, and fungal nails. Those we're absolutely any day of the week that you want to come and see us for that. So if you've got that kind of lower limb pain, injuries, then we're your people for that. In terms of any kind of sports injuries, so if you're maybe a runner, maybe tennis, and you're struggling with injuries, we can absolutely help you. When you come and see us, we are not only treating the problem, but we're dealing with the root cause of the problem. So if you need a full rehabilitation program, that's part of your packages with us, we would provide that as well. So that is Podiatry Glasgow. You can book directly online. The booking is open. I'll pop up, let's see, blah, 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 blah. Book an appointment. So to book an appointment, I'll pop it in the comments here. I'll just stick it in comments rather than a banner. But you can book. First thing that we would generally say is book a biomechanics appointment if you've got an MSK problem. If it's general podiatry, you would just book a podiatry appointment. I also want to say as well that we do things like diabetic foot screening. So if you have diabetes, you should be getting an annual foot screening. NHS wouldn't chase you for that. It's not something that is offered as standard. But it's something that you should be if you've got any kind of diabetes. Your foot risk should be getting assessed on an annual basis because, like anything, diabetes is very insidious. You don't feel unwell with diabetes, but it's like a silent bugger. So your feet get massively affected by it, and this is where things like ulcerations and things happen in foot amputations. So you should be getting checked on an annual basis and getting your feet screened and understanding your risk stratification, and then from there we can help keep you away from horrible ulcers. So that's it. If you need any help, we are your people. Lower limb from that pelvis down is absolutely our speciality. So if you need any help and you're in pain and you need to get out of pain, then don't hesitate to reach out. Have a fab Tuesday, and I'll see you again really soon.